Okay, viewers, you're welcome to the show again. Today, I want to talk about something very interesting. We want to talk about a very common disease in Nigeria. Today, I want to talk about a disease called diabetes. Diabetes mellitus, precisely, because there's another type of diabetes called diabetes insipidus, which is a different type of diabetes entirely. Just that they share similar symptoms, which are increased thirst and frequent urination. That's why they are both called diabetes. So diabetes insipidus is a disease that affects the water balance of the body. So it leads to the body getting rid of water from the body. It's quite different from diabetes mellitus. So today we want to talk about the disease called diabetes mellitus. Okay, so in this class, we're going to look at the meaning of diabetes mellitus as introduction to diabetes. We are going to look at symptoms of diabetes. We're going to look at what causes diabetes, and we're going to look at complications and management of diabetes. Are you ready? Okay, let's continue. So, what is diabetes? Diabetes is a condition whereby the sugar level of the blood is high. It's also known as hyperglycemia, when the sugar content of the blood is high. Okay, so diabetes occurs when the sugar content of the blood is high. By sugar here, I mean glucose. Okay, so I'm going to talk about glucose. I'm going to talk about the function of glucose. So what is glucose here? Okay, glucose here means the end product of carbohydrate. And so if I eat my rice, my yam, or my bread, which are examples of carbohydrate, my body will not absorb them in form of carbohydrate. It will have to be converted from carbohydrate to their end product, which is what? Glucose. And this conversion is made possible by the help of enzymes. What are enzymes? Enzymes are organic catalysts in the body that speed up the rate of chemical reaction but remain chemically unchanged at the end of the reaction. So if I eat my rice will not be absorbed into my body in form of rice. It will have to be converted from rice, that starch, to the end product, which is glucose. And this conversion is made possible by enzyme. It begins from the mouth. In the mouth, um, starch is converted to maltose. In the duodenum, starch is converted to glucose by an enzyme called amylase, and further conversion takes place in the small intestine. Okay, so glucose here means the end product of carbohydrate. It can also be referred to as what? As sugar. So diabetes occur when the glucose level of the blood is high. Okay, so that is that. Now, what is the function of this glucose in the body? Of course, we know that the function of carbohydrate is to generate energy. So what the glucose does to the body is to generate energy. So the glucose will be carried by the plasma of the blood to the various cells in the body for cellular respiration. And there are two processes involved in this. And they are the first one, which is glycolysis, and the second one, which is Krebs cycle. So the main purpose or the main function of the glucose in the body is to generate energy by the cells. Okay, now we know what the glucose is and its function in the body. Now the next question is, what actually causes diabetes? What is the mechanism to diabetes? How does diabetes occur? There are three organs that are involved in diabetes. These organs are the brain, the pancreas, and the liver, which I am holding here. So we have the brain, the pancreas, and the liver. These three organs are heavily involved in regulation of blood sugar in the body. Now the brain. What is the function of the brain? It is the brain that detects if the sugar level of the blood is high or low. So the carotid arteries take blood to the brain. And so the brain detects if the sugar content of the blood is high or low. But then the brain does not have the power um, to take out some of this sugar or to store it somewhere. There's an organ that has the power or the ability to deal with this high sugar level in the blood. And the organ is the liver here. So it is the liver that has the power to actually adjust the sugar level of the blood. But guess what? The liver cannot easily tell if the sugar content of the blood is high or low. So it needs to be given information by the brain. But then you agree with me that there is a gap between the brain and the liver. So the question now is, how does the brain relay information or message to the liver? Now the brain has what we call chemical messengers. And what are these chemical messengers? Hormones. So hormones are chemical messengers. What are hormones? Hormones are chemical substances that are produced by endocrine gland, transported by the plasma of the blood, and stimulate the target organs, meaning that these target organs may remain inactive or dormant until this hormone comes to tell them what to do. So there is a hormone called insulin. What is the function of the insulin? Now, the insulin is a hormone that actually stimulates the liver and allow it to carry out its function, meaning that if the insulin doesn't go to the liver will not be able to carry out its function. So what organ produces the insulin? It is the pancreas. So the pancreas produces the insulin goes to the liver and tell the liver what to do. Now, what does the liver really do when the insulin gets there? What would the liver do? How would the liver try to manage this situation? How does the liver remove excess sugar from the blood? The liver will store the excess sugar as animal fat, that's glycogen. Okay, so what does the insulin do? The insulin enables the liver to store excess glucose as glycogen. Okay, but then when the sugar content of the blood becomes normal, then that glycogen will have to be reconverted to what? To glucose, but with the help of another hormone called glucagon, which is also produced by what? By the insulin. So the main role of the insulin, or the main function of the insulin, is to tell the liver, is to stimulate the liver to store excess glucose as glycogen. Now, the inability of the liver to store excess glucose as glycogen leads to a disease called diabetes mellitus. But the inability of the liver to reconvert the glycogen to glucose may lead to a disease called hepatitis. Okay, now we have known what causes diabetes. Diabetes occurs when the liver is unable to store excess glucose as glycogen. Okay, so this may be as a result of the pancreas not producing enough insulin or not producing insulin at all. Okay, now let's look at types of diabetes. There are so many types of diabetes. We're going to look at the most common types of diabetes. The most common type of diabetes is type 2 diabetes. Yes, type 2 diabetes is a type of diabetes that occurs when the pancreas is unable to produce enough insulin, or when the pancreas is unable to produce insulin, thereby leading to high sugar content or high glucose level of the blood, which is hyperglycemia. The type 2 diabetes is the most common type of diabetes. It is found in both young and old. It's mostly found in older people. Okay, we have another type of diabetes called prediabetes. Prediabetes occurs when the sugar level of the blood is high, but not high enough to be diagnosed of type 2 diabetes. When the sugar level of the blood is considerably high, but not high enough to be considered type 2 diabetes. This type of diabetes can be temporary and can be reversed. Okay, then we also have what we call gestation diabetes. Gestation diabetes occurs due to pregnancy. It's a type of diabetes that occurs when a woman is pregnant. But of course, the blood sugar level returns back to normalcy after pregnancy. Uh, okay, then the other type of diabetes we have is type 1 diabetes. Now, type 1 diabetes is an autoimmune disease. What do I mean by autoimmune disease? An autoimmune disease is a disease that occurs when the immune system fights some cells in the body. When the immune system sees some cell as an enemy and then fight them, it leads to disease referred to as autoimmune disease. Type 1 diabetes occurs when the immune system fights the cells of the pancreas that produces insulin, and thereby making insulin production difficult. Okay, so this type of diabetes is called type 1 diabetes. Okay, so now we know what diabetes is. Now we know what causes diabetes. Now we have known the types of diabetes, few types. The types are listed here are the most common types, as we also have other types of diabetes. Okay, so now what are the symptoms of diabetes? The symptoms of diabetes varies in people and it's totally dependent on the type of diabetes you have. Okay, but then the most, or generally, the symptoms of diabetes include frequent urination. Okay, another symptom may be feeling thirsty or dry mouth. Okay, we also have blurred vision, not seeing clearly, and then fatigue, unexplained weight loss can also be a symptom. Difficulty in healing of wounds, that's delay in healing of wounds, may also be a symptom. Now we have known the symptoms of diabetes. Now, what are the complications of diabetes? The complication of diabetes may include heart disease, that's cardiovascular diseases. By cardiovascular disease, I mean diseases that affect the heart and the blood vessels. And some of the diseases that affect, or some of the complications may include heart attack, we have arteriosklerosis, we have coronary artery diseases, and some other cardiovascular diseases. Okay, even might also be um, stroke might also be a complication of diabetes, and even nerve problem, neurological disease can also occur if diabetes is left untreated. Okay, so the next question now is, how is diabetes treated, or how is diabetes managed? Okay, now the management of diabetes is totally dependent on the type of diabetes you have, and also the kind of symptoms you experience, because different people may experience different symptoms. But then the main treatment of diabetes include the use of diabetic drugs that help to reduce the sugar level of the blood. Okay, some of these drugs, I think the most common diabetic drug is metformin. So metformin helps in reducing the sugar content of the blood. And of course, in patients with severe cases of diabetes, like type 1 diabetes, and insulin will be needed. So synthetic insulin are used to reduce the sugar content of the blood. Okay, and apart from that, there are also some lifestyle changes that will help to reduce the sugar content of the blood. Some of them may include cutting down of your carbohydrate intake or sugar intake, and also exercise. Exercise helps to reduce the sugar content of the blood. Okay, so that is all for today. I hope you enjoyed our class. Till when next to me, thank you very much, and God bless you.